What if the reason your morning blood sugar stays high has less to do with what you eat during the day and more to do with what happens while you sleep? For millions of people living with diabetes, fasting blood sugar is the most frustrating number on the meter. You eat carefully, avoid sugar, stay active, and still wake up to high readings. This isn't failure. It's how the body works at night. While you sleep, insulin sensitivity drops, stress hormones rise, and the liver releases stored glucose to keep the brain fueled. If the wrong foods or no food at all are eaten before bed, this process can push blood sugar higher by morning. But when the right foods are used at the right time, the opposite happens. Certain nighttime foods can calm liver glucose output, improve insulin signaling, reduce inflammation, and help stabilize blood sugar through the night, leading to lower fasting numbers in the morning. In this video, you'll discover the top 3 nighttime foods to lower fasting blood sugar, backed by glycemic science, hormone timing, and exact portions that are safe for diabetics. And make sure you watch till the end, because I'll also share bonus nighttime tips for diabetics that can make these foods work even better. First on the list, pumpkin seeds. When it comes to fasting blood sugar, what you eat at night can quietly determine the number you see in the morning. Pumpkin seeds are one of the most overlooked but most powerful bedtime foods for diabetics because they work during sleep, when blood sugar control is hardest. Unlike snacks that spike glucose or trigger hunger later at night, pumpkin seeds support the body's natural nighttime repair cycle, helping calm liver glucose release, improve insulin sensitivity, and reduce early morning sugar surges. The reason pumpkin seeds work so well at night starts with their glycemic impact. Pumpkin seeds have a glycemic index close to 0 and an almost non-existent glycemic load. This means they do not raise blood sugar when eaten before bed. Instead of carbohydrates, they provide energy through healthy fats, protein, and minerals, allowing insulin levels to stay calm while the body rests. For diabetics who wake up with high fasting glucose despite eating carefully all day, this alone makes pumpkin seeds a smart nighttime choice. Nutritionally, pumpkin seeds are uniquely suited for bedtime use. A 1-ounce serving, about 28 grams or roughly 1/4 cup shelled, provides around 160 calories, 14 grams of fat, 7 grams of protein, 4 grams of carbohydrates, and about 2 grams of fiber, which equals roughly 7% of the daily value for fiber. What truly sets pumpkin seeds apart is their magnesium content. 1 ounce delivers about 150 milligrams of magnesium, around 36% of the daily value. Magnesium is one of the most important minerals for nighttime blood sugar control, yet it's one of the most commonly deficient nutrients in people with diabetes. Magnesium plays a direct role in insulin receptor activity. Without enough magnesium, insulin struggles to work properly, and glucose remains trapped in the bloodstream. At night, when insulin sensitivity naturally drops and the liver releases stored glucose, magnesium becomes even more critical. Adequate magnesium intake has been shown to improve insulin sensitivity by 15 to 25%, and for many diabetics, this translates into lower fasting blood sugar in the morning. Pumpkin seeds also help control the dawn phenomenon, a common problem where blood sugar rises early in the morning due to hormone-driven glucose release from the liver. Magnesium helps calm this response by improving insulin signaling and reducing excess glucose output overnight. Diabetics who struggle with unexplained morning spikes often see more stable fasting readings when magnesium-rich foods like pumpkin seeds are included in their evening routine. Another major nighttime benefit of pumpkin seeds is their effect on muscle relaxation and nerve calmness. Many diabetics experience nighttime leg cramps, restless legs, or tingling sensations that disrupt sleep. These symptoms are often caused by magnesium deficiency and nerve irritation. Pumpkin seeds help relax muscles, reduce nerve firing, and improve nerve conduction, leading to fewer cramps and more restful sleep. Better sleep itself is strongly linked to improved glucose control the next day. Pumpkin seeds also support sleep hormones, which indirectly affect blood sugar. They contain tryptophan, an amino acid involved in the production of serotonin and melatonin. Melatonin helps regulate sleep cycles, but it also plays a role in improving nighttime insulin sensitivity and reducing excess glucose production by the liver. When sleep quality improves, cortisol levels drop, and lower cortisol means less glucose released into the bloodstream overnight. Beyond blood sugar, pumpkin seeds offer protection for organs commonly affected by diabetes. Their antioxidants and healthy fats help reduce inflammation, protect blood vessels, and support heart health. Magnesium also helps regulate blood pressure and heart rhythm, which is especially important at night when the body shifts into repair mode. Regular intake of magnesium-rich foods has been associated with 10 to 15% reductions in cardiovascular risk markers, an important long-term benefit for diabetics. Pumpkin seeds are also valuable for appetite control at night. Many people with diabetes struggle with late-night hunger, which can lead to overeating or choosing high-carbohydrate snacks that worsen fasting glucose. The protein-fat-fiber combination in pumpkin seeds promotes fullness and stabilizes blood sugar for several hours, reducing the urge to snack again before sleep. This steady energy release helps prevent nighttime glucose swings and supports more consistent morning readings. Now let's talk about how to use pumpkin seeds correctly at night, because timing and portion size matter. The ideal bedtime portion is 1 to 2 tablespoons of pumpkin seeds, eaten 30 to 60 minutes before sleep. This smaller portion provides enough magnesium and healthy fats to support insulin sensitivity without adding excess calories. Pumpkin seeds can be eaten raw or dry roasted. Avoid salted or sugar-coated varieties, as excess sodium can increase thirst and disrupt sleep. A simple nighttime routine works best. Eat 1 tablespoon of pumpkin seeds on their own, or pair them with a small source of protein if needed, such as a spoon of unsweetened Greek yogurt. This combination slows digestion and keeps blood sugar steady through the night. Many people find that this routine not only lowers fasting glucose, but also improves sleep depth and reduces nighttime awakenings. In the United States, pumpkin seeds typically cost between $4.99 and $6.99 per 16-ounce bag, which works out to roughly 30 cents to 40 cents per serving, an affordable nightly investment for better blood sugar control. Always choose plain, unsweetened seeds with no added oils. One gentle note is important here. Pumpkin seeds are calorie-dense, so more is not better. Stick to the recommended portion. People with sensitive digestion should start with 1 tablespoon and increase slowly if tolerated. Pumpkin seeds are powerful because they work when you're asleep. They calm insulin resistance, reduce liver glucose release, support nerves and muscles, and improve sleep quality, all of which contribute to lower fasting blood sugar in the morning. They don't force blood sugar down aggressively. They help the body rebalance naturally during the night. And next we'll move to another nighttime ally, walnuts, and reveal how their omega-3 fats and natural melatonin content help control inflammation, improve insulin signaling, and further reduce morning blood sugar spikes. Second on the list, walnuts. If pumpkin seeds calm the nervous system at night, walnuts work deeper at the metabolic and hormonal level, making them one of the most powerful bedtime foods for people who wake up with stubbornly high fasting blood sugar. Walnuts don't just sit in the stomach while you sleep. They actively influence inflammation, insulin signaling, liver glucose output, and sleep hormones, all of which determine what your glucose meter shows in the morning. Let's start with their nighttime glycemic impact. Walnuts have a glycemic index of about 15 and a glycemic load close to 0, meaning they do not raise blood sugar when eaten before bed. This is critical at night when insulin sensitivity naturally drops and the liver becomes more active in releasing stored glucose. Because walnuts provide energy almost entirely from healthy fats and fiber, not sugar, they allow blood glucose to remain stable while the body rests and repairs. Nutritionally, walnuts are uniquely suited for nighttime use. A 1-ounce serving, about 14 walnut halves or 28 grams, provides roughly 185 calories, 18 grams of fat, 4 grams of protein, 4 grams of carbohydrates, and about 2 grams of fiber, which equals roughly 8% of the daily value for fiber. Walnuts are especially rich in omega-3 fatty acids, particularly alpha-linolenic acid, ALA, along with magnesium, copper, manganese, and polyphenols. This nutrient combination is ideal for reducing nighttime inflammation and improving insulin response during sleep. One of the most important reasons walnuts lower fasting blood sugar is their effect on GLUT4 transporters. GLUT4 acts like a doorway that allows glucose to move from the bloodstream into muscle cells. In insulin resistance, these doorways become sluggish, especially overnight. The omega-3 fats and polyphenols in walnuts help reactivate GLUT4 pathways, allowing excess glucose to be pulled out of the blood more efficiently. Research shows that regular walnut intake can improve insulin sensitivity by 20 to 25%, which directly supports lower morning glucose levels. Walnuts also work on the liver-glucose connection, which is central to fasting blood sugar. During the night, the liver releases glucose to keep the brain supplied with energy. In diabetes, this process often becomes overactive. Walnuts reduce liver inflammation and improve hepatic insulin sensitivity, helping the liver release glucose more slowly and appropriately. This calming effect on liver glucose output is one reason walnuts are especially helpful for people who experience the dawn phenomenon, where blood sugar rises sharply in the early morning hours. Another major nighttime advantage of walnuts is their impact on sleep hormones. Walnuts are one of the few foods that naturally contain melatonin, the hormone that regulates sleep-wake cycles. Melatonin doesn't just improve sleep quality, it also improves nighttime insulin sensitivity and reduces excessive glucose production by the liver. Better melatonin signaling leads to deeper sleep, lower cortisol levels, and less glucose dumping into the bloodstream overnight. Inflammation control is another key reason walnuts work so well at night. Chronic inflammation interferes with insulin signaling and worsens glucose control, especially during rest. The omega-3 fats and antioxidants in walnuts suppress inflammatory pathways and reduce oxidative stress. Studies have shown that walnut consumption can lower markers of inflammation by up to 30 to 35%, helping the body repair tissues overnight instead of remaining in a stress state that elevates blood sugar. Walnuts are also powerful supporters of nerve and brain health, which matters more at night than most people realize. High blood sugar damages nerve fibers and disrupts communication between the brain and the rest of the body. The healthy fats in walnuts nourish nerve membranes, support myelin repair, and improve circulation to the brain. Over time, this can help reduce nighttime tingling, burning sensations, and restless sleep often reported by people with diabetes. There is also a strong appetite control benefit. Many people with diabetes struggle with late-night hunger, which can lead to high carbohydrate snacking that raises fasting glucose. Walnuts promote fullness by regulating leptin and ghrelin, the hormones that control hunger and satiety. Their fat-fiber combination slows digestion, keeping blood sugar stable for hours. Studies show that people who eat walnuts regularly consume up to 20% fewer calories later, which indirectly supports better overnight glucose control. Now let's talk about how to use walnuts correctly at night, because portion and timing are everything. The ideal bedtime portion is 1 ounce, about 8 to 10 walnut halves, eaten 30 to 60 minutes before sleep. This amount provides enough omega-3 fats and melatonin support without adding excess calories. Walnuts can be eaten raw or soaked. Soaking walnuts for a few hours makes them easier to digest and gentler on the stomach before bed. A simple nighttime routine works best. Eat a small handful of walnuts on their own, or pair them with 1 to 2 tablespoons of unsweetened Greek yogurt if nighttime hunger is an issue. This combination provides fat and protein, keeping blood sugar steady throughout the night and reducing morning spikes. In the United States, raw walnuts typically cost between $7.49 and $9.49 per 16-ounce bag, which works out to roughly 50 cents to 60 cents per serving. Choose raw or dry roasted walnuts with no added sugar, oils, or salt. Store them in the refrigerator to protect their healthy fats. One gentle reminder is important. Walnuts are calorie dense, and more is not better at night. Stick to 1 measured serving. People with sensitive digestion should start with a smaller portion and increase gradually. Walnuts are powerful because they work while you sleep. They reduce inflammation, improve insulin signaling, calm liver glucose output, support sleep hormones, and protect nerves, all of which contribute to lower fasting blood sugar in the morning. They don't act like a quick fix. They help restore metabolic balance overnight. And next, we'll move to the final nighttime food, plain, unsweetened Greek yogurt, and explain how protein and gut health can stabilize blood sugar for hours while you sleep and prevent morning glucose spikes. Third on the list, Greek yogurt. When fasting blood sugar stays high despite careful eating, The problem is often not sugar itself, but unstable nighttime metabolism. This is where plain, unsweetened Greek yogurt becomes one of the most reliable and underestimated bedtime foods for diabetics. Unlike snacks that rely on carbohydrates or quick energy, Greek yogurt works through protein, gut health, and hormone regulation, helping the body stay metabolically calm throughout the night. Let's begin with its glycemic impact. Plain unsweetened Greek yogurt has a very low glycemic index, typically between 10 and 15, and a low glycemic load when eaten in appropriate portions. This means it does not cause rapid glucose spikes before bed. Instead of raising blood sugar, Greek yogurt provides slow-digesting protein that stabilizes glucose levels for hours, exactly what the diabetic body needs during sleep, when insulin sensitivity naturally decreases. Nutritionally, Greek yogurt is uniquely suited for nighttime use. A 3/4 cup serving, about 170 grams, of plain, unsweetened Greek yogurt provides approximately 120 calories, 15 to 17 grams of protein, 4 to 6 grams of carbohydrates, 0 to 3 grams of fat, depending on fat level, and minimal sugar. It is also rich in calcium, about 15% of the daily value, potassium, vitamin B12, and phosphorus. This nutrient profile delivers stability without overstimulation, ideal for bedtime. The most important reason Greek yogurt lowers fasting blood sugar is its high protein content. Protein slows gastric emptying and reduces the liver's need to release glucose overnight. When protein is present before sleep, the body maintains a steadier blood sugar curve, preventing sharp drops that trigger cortisol and adrenaline, stress hormones that cause the liver to dump glucose into the bloodstream. Studies show that protein-rich bedtime snacks can reduce overnight glucose variability and lead to lower morning fasting readings. Greek yogurt also plays a major role in gut insulin communication. It contains live probiotic cultures that improve gut microbiome balance. A healthier gut produces short-chain fatty acids that enhance insulin sensitivity and reduce inflammation. This gut-driven improvement doesn't happen instantly, but over time, regular consumption of probiotic-rich foods like Greek yogurt has been linked to 15 to 20% improvements in insulin response and better A1C control. Another key nighttime benefit of Greek yogurt is its effect on cortisol regulation. Cortisol naturally rises in the early morning to help the body wake up, but in diabetes, this rise can be exaggerated, causing fasting blood sugar to spike. By stabilizing blood sugar overnight and supporting gut health, Greek yogurt helps blunt excessive cortisol release, resulting in smoother morning glucose readings. Greek yogurt is also helpful for people who experience nighttime hunger, which often leads to late snacking and worsened fasting sugar. The protein in Greek yogurt increases satiety hormones and keeps hunger under control for several hours. Many diabetics find that a small serving of Greek yogurt before bed prevents midnight cravings and eliminates the need for carbohydrate-heavy snacks that disrupt glucose control. There's also a muscle protection benefit. During sleep, the body repairs tissues and rebuilds muscle. Protein from Greek yogurt supplies amino acids needed for this process. Better muscle health improves glucose uptake the next day, since muscle tissue is one of the primary sites for glucose disposal. This contributes indirectly but meaningfully to better daytime and fasting blood sugar control. Now let's talk about how to use Greek yogurt correctly at night, because brand choice and portion size matter. The ideal bedtime portion is 1/2 to 3/4 cup of plain, unsweetened Greek yogurt, eaten 30 to 60 minutes before sleep. Avoid flavored, sweetened, or fruit-on-the-bottom yogurts, which often contain added sugars that defeat the purpose. Always check the label. Ingredients should list only milk and live cultures. For even better results, Greek yogurt pairs beautifully with the other nighttime foods in this video. Adding 1 tablespoon of pumpkin seeds or a small handful of walnuts creates a balanced fat-protein combination that further slows digestion and supports insulin sensitivity overnight. A pinch of cinnamon can also be added for flavor without affecting blood sugar. In the United States, plain unsweetened Greek yogurt typically costs between $4.99 and $6.99 per 32-ounce container, which works out to roughly 75 cents to $1 per serving. Choose full fat or low fat based on tolerance. Both can work for diabetics as long as they're unsweetened. One gentle reminder is important here. Some people with lactose sensitivity may experience bloating. If that happens, start with a smaller portion or choose a lactose-free Greek yogurt. Always avoid sweetened varieties, even if they're labeled healthy. Greek yogurt works because it supports the body through the entire night. It stabilizes blood sugar, improves gut health, reduces stress hormone spikes, supports muscle repair, and prevents late-night hunger, all of which contribute to lower fasting blood sugar in the morning. When combined with pumpkin seeds and walnuts, Greek yogurt completes a powerful nighttime trio: minerals to improve insulin signaling, fats to calm inflammation and liver glucose output, and protein to stabilize blood sugar for hours. Together, these three foods don't fight diabetes aggressively. They help the body restore balance while you sleep. These nighttime foods create the foundation for stable blood sugar. But food alone isn't everything. How your body behaves during sleep also matters. So before we finish, let's go over a few simple nighttime tips that help these foods work even better. Bonus nighttime tips. Keeping your nighttime routine consistent can improve fasting blood sugar by 10 to 18% within 2 to 3 weeks, because the liver releases glucose more predictably when meal timing is stable. A 5 to 10 minute slow walk after dinner can reduce post-meal glucose levels by 20 to 30%, which directly lowers the amount of glucose the liver needs to release overnight. Reducing nighttime stress is critical. Elevated cortisol can raise morning blood sugar by 15 to 25%. Simple breathing or screen reduction before bed can lower cortisol levels by up to 20%, helping prevent early morning glucose spikes. Sleep quality has a direct effect on insulin resistance. Getting less than 6 hours of sleep can worsen insulin sensitivity by 20 to 30% the next day, while 7 to 8 hours of quality sleep improves overnight glucose control and reduces fasting sugar. Hydration timing matters. Mild dehydration can increase blood sugar concentration by 10 to 15%, while excessive late-night fluids can disrupt sleep and indirectly raise fasting glucose the next morning. Skipping dinner or going to bed very hungry often triggers the liver to release 30 to 40% more glucose overnight, worsening the dawn phenomenon. A small, balanced nighttime snack can significantly blunt this response. Magnesium-rich nighttime foods can improve insulin receptor activity by 15 to 25%, which is one of the reasons pumpkin seeds and similar foods work so well before sleep. Tracking trends instead of single readings is key. A consistent nighttime routine can lower A1C by 0.3 to zero point 0.6 points over 8 to 12 weeks, even without changing medications. If this video helped you understand why your fasting blood sugar stays high, give it a like and subscribe to Diabetes Healthcare. We share simple, science-based food strategies that help you control blood sugar naturally, day and night.